Nobody can be under any illusions about the levels of pressure which our health and care system are facing at the present time. And of course, Greater Manchester is no different from any other part of the country in that respect. But about 2 years ago, a number of leaders from across Greater Manchester decided that we didn't just want to leave it to national organisations to decide what our priorities were for our health and care system here in Greater Manchester. Why couldn't we actually start to decide those things for ourselves, to make those difficult decisions about how we allocate resources, but most importantly, to get the focus on the health of our population and the particular needs of our residents, whether they're living in Bury, Oldham, Trafford, and so on. And so we put that proposition to the national NHS bodies and up to government, and including the Chancellor of the Exchequer. And they decided that yes, if we could devolve on transport and business, why not public service reform, and why not health and social care? And so last April, we took responsibility for £6 billion of NHS expenditure, and we joined it up with our spending for public health and social care, which lies in local government. And we started to plan how we would spend that money more effectively. Our model of care puts primary care at its heart. We believe that the relationship between an individual and their GP, supported by the rest of primary care, is at the heart of our NHS and our broader health and care system. And it is a relationship that over many years has been eroded. But in the Greater Manchester way of seeing the world, we want to restore the primacy of that relationship. But for that to be meaningful, we need to do a number of things. The first is that we need to ensure that primary care is as much as possible adequately resourced for the task that they face. But second, we need to organise a whole number of other services around primary care, so that they are genuinely at the heart of the care model. That doesn't just mean other primary care services, important though they are. It actually means a broader set of community services, including social care, but perhaps even stretching to things like housing and welfare support. Now, that will mean some change for primary care itself within our care model. Not giving up the essentials of that primacy of the relationship with the individual and the GP, but actually maybe doing some things on a more collective basis, operating at higher levels of population, maybe at a 30 to 50,000 population level. And by working at that level, it will make it easier for us to actually cluster those other community services around primary care and provide a higher quality of care to the population.